As America and even his own administration woke up to the threat of COVID-19, the fat ass 45 still didn't seem to get it. Within weeks of suggesting that people social distance in mid-March, the fat ass went on national TV to argue that the U.S. could reopen by Easter Sunday in April, and you'll have packed churches all over our country, fat ass 45 said in March. I think it'll be a beautiful time. The U.S. wasn't able to fully and safely reopen in April, and it isn't able to, and now we're in the middle of September, and it still isn't fully able to open back up and safely reopen. The virus rages on, affecting every aspect of American life, from the economy to education to entertainment. Nearly 190,000 Americans are dead, and schools are closing down again after a botched attempt to reopen. With outbreaks in universities and in the kindergarten to 12th grade settings, America has now become one of the worst ongoing epidemics in the world, with the most daily new deaths among developed nations. Before fall arrived in person, teaching was back in parts of Europe, and fans returned to baseball stadiums in Taiwan and South Korea, and dine-in reservations jumped to previous years' levels in Germany, while many states in the U.S. had to scale back their already limited reopenings as the disease continued to spread. The Easter episode, experts said, exemplified the magical thinking that has animated Fat Ass 45's response to the COVID-19 pandemic before and after the novel coronavirus reached the U.S. It's a problem that's continued through September, with Fat Ass 45 and those under him recently denying the existence of a resurgence in COVID-19, and they basically lied, claiming rising cases were a result of more tests. With every day, week, and month that the Fat Ass 45 administration has tried to spin a positive story, it's also resisted stronger action, allowing the epidemic to drag on. A pandemic was always likely to be a challenge for the U.S. anyway, given the country's large size, fragmented federalist system, and libertarian streak. The public health system was already underfunded and underprepared for a major disease outbreak before Fat Ass 45 took office. Yet many other developed countries dealt with these kinds of problems too. Public health systems are notoriously underfunded worldwide. Australia, Canada, and Germany, among others, also have federalist systems of government, individualistic societies, or both. Instead, the experts said it's Fat Ass 45's failed leadership, or lack thereof, that really sets the U.S. apart. Before COVID-19, Fat Ass 45 and his administration undermined the preparedness, eliminating the White House office set up by the previous administration to combat the pandemics, making cuts across other key parts of the federal government, and proposing further cuts. Once the coronavirus arrived, Fat Ass 45 downplayed the threat, suggesting that it would soon disappear like a miracle, and the Centers for Disease Control and Prevention took weeks to fix the botched test, and the administration actively abdicated control of issues to local, state, and private actors. There was a failure to realize what an efficiently spreading respiratory virus, for which we have no vaccine and no antiviral, meant. Said Amish Adolja, a senior scholar at the Johns Hopkins Center for Health Security. From the very beginning, that minimization set a tone that reverberated from the highest levels of government to what the average person believes about the virus. Several developed countries, which included Belgium, France, Italy, and Spain, were caught off guard by the pandemic and were hit hard early on, suffering massive early outbreaks with enormous death tolls. But most developed countries took these crises seriously, adopting a lengthy and strict lockdown, widespread testing, and contact tracing, masking mandates, and consistent public messaging about the virus. Though Spain and France are now seeing second waves, seemingly because they prematurely relaxed social distancing measures, America did not take the steps necessary even after the outbreak spiraled out of control in New York. Now, the U.S. has about 7 times the COVID-19 deaths as the median developed country, ranking it in the bottom 20% for coronavirus deaths among wealthy nations. Tens of thousands of lives have been needlessly lost as a result. If America had the same death rate as, for example, Canada, 100,000 more Americans would likely be alive today. If George Bush had been president, if John McCain had been president, if Mitt Romney had been president, this would have looked a whole lot different, says Ashish Jha, the faculty director of the Harvard Global Health Institute, had said. Emphasizing the failure to act after COVID-19 hit the U.S. hard was a phenomenon driven by Fat Ass 45. Experts worry that things will again get worse. Colder weather is coming forcing people back into risky indoor environments. So our holiday celebrations, when when family and friends will gather together from across the country, another flu season looms, and Fat 45 experts lamented is not ready to do much, if anything, about it. The White House disputes the criticism. Spokesperson Sarah Matthews claimed that Fat 45 has led an historic whole of America coronavirus response that followed experts' advice. No, it didn't. And there was nothing historic about it, and he didn't do shit, really. Boosted testing rates, delivered equipment to healthcare workers, and remained focused on expediting the vaccine. Yeah, bullshit. He does not have any strong leadership, so fuck off, bitch. The U.S. wasn't prepared for a pandemic, and 45 made it worse. At least Fat Ass 45 did. During the 2014 Ebola outbreak, the president back then, Barack Obama's administration, realized that the U.S. wasn't prepared for a pandemic. Jeremy Conendike, who served in the Obama administration's Ebola response, said he came away from that experience just completely horrified at how ready we would be for something more dangerous than Ebola, which has a high fatality rate, but did not spread easily in the U.S. and other developed nations. The Obama administration responded by setting up the White House National Security Council's Directorate for Global Health Security and Biodefense, which was meant to coordinate the many agencies, from the CDC to the Department of Health and Human Services to the Pentagon, involved in the contagious response. When John Bolton became Fat Ass 45's National Security Advisor in 2018, he moved to the disbanded office. In April of 2018, Bolton fired Tom Bossert, who was then the Homeland Security Advisor, who the Washington Post reported had called for a comprehensive biodefense strategy against pandemics and biological attacks. Then in May, Bolton let go the head of the pandemic response, which was the Rear Admiral Timothy Zimmer, and dismantled his global health security team. Bolton claimed that the cuts were needed to streamline the National Security Council, and the team was never replaced. In the months before the coronavirus arrived, the Fat Ass 45 administration also cut a public health position meant to detect outbreaks in China, and another program called Predict that tracked emerging pathogens around the globe, including coronaviruses. And Fat Ass 45 was repeatedly called for further cuts to the CDC and National Institutes of Health, both on the front lines of the federal response to disease outbreaks, and the administration stood by the proposed cuts after the pandemic began, though Congress has largely rejected the proposal. The Fat Ass 45 administration pushed for the cuts despite multiple clear warnings that the U.S. was not prepared for a pandemic. A 2019 ranking of countries' disaster preparedness from the Johns Hopkins Center for the Health Security and Nuclear Threat Initiative had the U.S. at the top of the list, but it still warned that no country is fully prepared for epidemics or pandemics. A federal simulation prior to the COVID-19 pandemic also predicted problems that the U.S. eventually faced, from a collapse in coordination and communication to shortages in personal protective equipment or healthcare workers. Bill Gates, who's dedicated much of his Microsoft fortune to fighting the infectious diseases, had warned back in 2017 the impact of a huge epidemic like a flu epidemic would be phenomenal because all the supply chains would break down, there would be a lot of panic, and many of the systems would be overloaded. Gates told the Washington Post in 2018 he had raised his concerns in meetings with Fat Ass 45, but the Fat Ass, it's now clear, never listens anyway. These are limitations to better preparedness too. If you take what assets the United States had and you use them poorly the way that he did, it doesn't matter what the report says. Adalja said, referring to the 2019 Reagan, if you don't have the leadership to execute, then it makes no fucking difference. As the COVID-19 spread, Fat Ass 45 had downplayed the threat. On February 25th, Nancy Messonnier, director of the CDC's National Center for Immunization and Respiratory Diseases, had told reporters that the Americans should prepare for community spread of the coronavirus, social distancing, and the possibility that disruption to everyday life might be severe. 6 months later, Messonnier's comments seemed prescient, but soon after the briefing, she was pushed out of the spotlight, though she's still on the job. Her press appearances have been limited, reportedly because her negative outlook angered Fat Ass 45. Messonnier didn't respond to her request for comment. The CDC as a whole has been pushed to the sidelines with her. The agency is supposed to play a leading role in America's fight against pandemics but it's invisible in press briefings led by Fat Ass 45. Dumbass Mike Pence and the advisors and health officials like Anthony Fauci and Deborah Birx, who are not a part of the organization. CDC Director Robert Redfield had acknowledged as much. You may see the CDC as invisible on the nightly news, but it's not. But it's not. It's sure not invisible in terms of operationalizing this response. University of Michigan medical historian Howard Markle put it in blunt terms, basically saying that the U.S. has benched one of the greatest fighting forces against infectious diseases ever created. Meanwhile, the fat ass has downplayed the virus. The day after Messenger's warning, Fat Ass 45 said that you have 15 people with the coronavirus, and the 15 with a couple of days is going to be down close to zero. This type of magical thinking appears to have driven Fat Ass 45's response to COVID-19 from the start. From his conviction that the case would disappear to his proclamation that the country would reopen by Easter, this was deliberate. As Fat Ass 45 later acknowledged in recorded interviews with the journalist Bob Woodward, he knew that the coronavirus was deadly, airborne, and more dangerous than the flu, and that it could afflict both the young and old. Yet he deliberately downplayed the threat. He basically said he always wanted to downplay it. He told Woodward on March 19th, he's like, I still like to playing it down because I don't want to create a panic. Fat Ass 45 has long said he believes in the power of positive thinking, and that he has been given a lot of credit for positive thinking, though he hasn't. He told Axios reporter Jonathan Swan during a wide-ranging discussion about COVID-19 back in July. But also, he said, but also think about the downside because only a dumbass doesn't. Press further, he added, I think you have to have a positive outlook, otherwise you have nothing. Yeah, you accomplish nothing. That's about what it is. The concern, experts said, is the signal that this message sends that tells the staffers under Fat Ass 45 that this issue isn't a priority and that things are fine as they are. And it suggests to the public that the virus is under control so they don't have to make annoying, uncomfortable changes to their lives from physical distancing to wearing masks. It creates the perfect conditions for a slow and inadequate response. The CDC reported, or basically botched the initial test kits it sent out, and it took weeks to fix the error. The Food and Drug Administration, FDA, also took weeks to approve other tests from private labs as supply problems came up with testing kits, swabs, reagents, machines, and more. The Fat Ass 45 administration resisted taking significant action, claiming it's up to local, state, and private actors to solve the problems, and that the federal government is merely a supplier of the last resort. South Korea, which has been widely praised for its response to the coronavirus, tested more than 66,000 people within a week of the first community transmission within its border. By comparison, the U.S. took roughly 3 weeks to complete that many tests, and the country with more than 6 times the population. Asked about testing problems in March, Fat Ass 45 responded, I don't take responsibility at all. In June, Fat Ass 45 claimed that testing is a double-edged sword, adding that when you do testing to that extent, you're going to find more people, you're going to find more cases. So I said to my people, slow the testing down, which was a fucking dumb move on his part. The testing shortfall was a problem few thought that the few had thought possible in the wealthiest, most powerful nation on earth. We all kind of knew if a biological event hit during this administration, it wasn't going to be good. Saskia Popescu, an infectious disease epidemiologist, said, I don't think anyone ever anticipated that it could get this bad. Fat Ass 45 also consistently undermined the advice of the experts, including those in his administration. When the CDC released reopening guidelines, Fat Ass 45 effectively told states to ignore the guidance and reopen prematurely to liberate their economies. When the CDC recommended masks for public use, Fat Ass 45 described masking as a personal choice and refused to wear one in public for months, and even suggested that people wear masks to fight him. He's changed his tone recently while federal agencies and researchers work diligently to find effective treatments for COVID-19. Fat Ass 45 has promoted unproven and even dangerous approaches, at one point advocating for injecting bleach into the body. The most aggressive steps that Fat Ass 45 took to halt the virus, travel restrictions on China and Europe imposed in February and March, respectively, were likely to be limited and to be too late. And to the extent that these measures brought time it wasn't properly used, the federal government is the only entity that can solve many of the problems that the country is facing. If testing supply shortfalls in Maine are slowing down testing in Arizona or Florida, the federal government has the resources and the legal jurisdiction to quickly act. Local or state officials looking for advice on how to react to a national crisis will typically turn to the federal government for guidance. But the inaction, contradictions, and counterproductive messaging created a vacuum in federal leadership. In the months after Fat Ass 45's prediction that the coronavirus cases would go down to zero. Confirmed cases in the U.S. grew to more than 160,000 as of September 9th. They stand at more than 6.3 million. Months into the pandemic, Fat Ass 45 has continued to fail. After the initial wave of the coronavirus cases began to subside in April, the White House stopped its daily press briefings on the topic. By June, Fat Ass 45's tweets and public appearances focused on Black Lives Matter's protest and the 2020 election, part of what political reporter Dan Diamond described, based on discussions with administration officials, as an apparent eagerness to change the subject. Then another wave of coronavirus infections hit beginning in May, peaking with more than 70,000 daily new cases, a new high, and more than 1,000 daily deaths. America's response to the initial rise of infections was slow and inadequate, but other developed countries also struggled with the sudden arrival of a disease brand new to humans. The second surge, experts said, was when the scope of the Fat Ass 45's failure became more apparent. By pushing states to open prematurely, failing to set up national infrastructure for testing and tracing, and downplaying masks, Fat Ass 45 put many states under enormous pressure to reopen before the virus was under control nationwide, and many quickly did, and over time they suffered big consequences. Rather than create a new strategy, Fat Ass 45 and his administration had returned to magical thinking. The dumbass Pence, head of the White House's coronavirus task force, wrote an op-ed titled "There Isn't a Coronavirus Second Wave" in mid-June, as cases started to increase again. Internally, some of Fat Ass 45's experts seemed to believe Des Burks, once a widely respected infectious disease expert, had reportedly told the Fat Ass and White House staff that the U.S. was likely following the path of Italy. Cases hit a huge high, but would steadily decline again. Fat Ass 45 trotted out optimism, but misleading claims and statistics. He told Axios reporter Jonathan Swan in July that the U.S. is doing well because it had few deaths relative to the number of cases. When Swan, clearly baffled, clarified he was asking about deaths as a proportion of population, a standard metric for an epidemic's deadlines. Fat Ass 45 said you can't do that. He gave no further explanation. Seemingly believing that its coronavirus mission accomplished, the Fat Ass 45's administration and the New York Times reported they moved to relinquish responsibility for the pandemic and leave the response to the states in what the Times called perhaps one of the greatest failures of the failed leadership in generations. The biggest problem is the U.S. response. The biggest problem in the U.S. Response is there is not a U.S. response, Conan Dyke said, now a senior policy fellow at the Center for Global Development. There is a New York response. There's a Florida response. There's a Montana response. There's a California response, and there's a Michigan response and a Georgia response. But there is no U.S. response. When the coronavirus first hit the U.S., the country struggled with testing enough people and contact tracing and getting the public to follow recommendations such as physical distancing and masking. Delivering enough equipment for healthcare workers and hospital capacity in the second wave, these problems have, by and large, repeated themselves. Consider testing has significantly improved, but some parts of the country have reported weeks-long delays in getting test results, and the percentage of tests coming back positive has risen above the recommended 5% in most states. A sign of insufficient testing, the system once again appeared to collapse under the weight of too much demand. While the federal government failed to solve continuing problems with supply chains months after Congress approved billions of dollars in spending to deal with the testing problems, the Fat Ass 45 administration has not spent much of it. Some of Fat Ass 45's response even seemed to listen to his calls to slow down testing. On August 24th, the CDC updated its guidelines to recommend, in effect, that fewer people get tested. It suggested people exposed to others with COVID-19 don't necessarily have to get tested, in a move that experts have called dangerous and irresponsible. Mask wearing also remains polarized. While surveys show that the vast majority of Americans have worn masks in the past week, there's a strong partisan divide. According to Gallup surveys, 99% of the Democrats said they've gone out with a mask in the previous week, compared to 80% of Republicans. Leveraging surveys on masks used, the New York Times estimated that the percentage of people using masks in public can fall to as low as 20 or 10 or the single digits, even in some communities that have been hit hard. Anti-mask protests have popped up all around the country. Testing and mask wearing are two of the strongest weapons against COVID-19. Testing paired with contact tracing lets officials track the scale of an outbreak, isolate those who are sick, quarantine their contacts, and deploy community wide efforts as necessary to contain the disease, as successfully demonstrated in Germany, New Zealand, and South Korea, among others. There's also growing scientific evidence supporting widespread and even mandated mask use, with experts citing it is crucial to the success of nations like Japan and Slovakia in containing the virus. It's not that other developed nations did everything perfectly. New Zealand has contained COVID-19 without widespread masking, and Japan has done so with widespread testing. But both took at least one aggressive action that the U.S. hasn't. While there's variation across many countries, the thing that distinguishes the countries doing well is they took something seriously. Kirsten Bibbins Domingo, an epidemiologist at the University of California, San Francisco, had said, one explanation for the shortfalls in the U.S. response is Fat Ass 45's obsession with getting America, particularly the economy, back to normal in the short term. Seemingly before the election this November, it's why he's called on governors to liberate states. It's why he's repeatedly said that the cure can't be worse than the problem itself. It's one reason, perhaps, that he resisted embracing even very minor lifestyle changes such as wearing a mask. The reality is that life will only get closer to normal once the virus is suppressed. That's what's working for other countries that are more earnestly reopening, from Taiwan to Germany. It's what a preliminary study on the 1918 Spanish flu found. As U.S. cities that emerged economically stronger back then took more aggressive action that hindered the economies in the short term, but better kept the infections and deaths down overall. Dead people don't shop. Said Jade Bather, an infectious disease expert and doctor at the University of Chicago, has said they can't stimulate the economy. The window to avert further catastrophe may be closing in. As cases and deaths have climbed, and as the November election nears, Fat Ass 45 has once again tried to spring back into action. He's brought back his coronavirus press conferences. He's changed his tone on masks, suggesting that it's Americans' patriotic duty to wear one, although not always doing so himself. But he still seems resistant to focusing too much on the issue. Recently, changing the subject to former Vice President Joe Biden's supposed plans to destroy the suburban lifestyle, he continues to downplay the crisis, saying on July 28th as daily COVID-19 deaths once again topped 1,000. He he said it is what it is. So basically, he doesn't give a shit. His Republican convention continued to downplay the risk of COVID-19 and exaggerate Fat Ass 45's success in fighting the virus. So while combating the COVID-19 lines with Fat Ass 45's political incentives, it remains America's top priority, and he and his administration continue to flounder. And while the White House officials stand by their response so far, continually pushing blame to local and state governors, there is no national plan to combat the worst pandemic that we've seen in a century, said Jen Cates, who is the director of global health and HIV policy at the Kaiser Family Foundation. The recent surge of the COVID-19 has calmed now, although cases across the U.S. Have so far flattened out at much higher level than they were in the previous wave. That's likely a result of cities, counties, states, and the public taking action as the federal government doesn't. Experts now worry that the country could be setting itself up for another wave of COVID-19. Schools reopening across the country could create new vectors of transmission. The winter will force many Americans indoors to avoid the cold, while being outdoors in the open air can hinder the spread of the disease. Families and friends will come together from across the country to celebrate the holidays, creating new possibilities for super spreading events. And in the background, another flu season looms, which could limit healthcare capacity further, just as COVID-19 cases spike. The virus spreads when a large number of people gather indoors. Jaha said that's going to happen more in December than it did in July, and July was a pretty awful month. There are reasons to believe it might not get so bad, since so many people in the U.S. have gotten sick. That could offer some element of population immunity in some places as long as people continue social distancing and masking. After seeing 2 large waves of the coronavirus across the country, the public could act cautiously and slow the disease down. Even if local, state, and federal governments don't social distancing due to COVID-19, it could keep the spread of the flu down, to which seemed to happen in the South Hemisphere. But the federal government could do much more to push the nation in the right direction. Experts have urged the federal government to provide clear, consistent guidance and deploy stronger policies encouraging people to take COVID-19 as a serious threat, now and not later. People are really concerned that the window might be closing, Kate said. Without that federal action, the U.S. could remain stuck in a cycle of ups and downs with COVID-19, forcing the public to double down on social distancing and other measures with each new wave. As cases and deaths continue to climb, the country will become even more of an outlier as the rest of the developed world inches back to normal, and the beautiful time that Fat Ass 45 imagined for Easter will remain out of reach. Yep. So if you like the video, give the video a like and subscribe to my channel, Random Mike, and also hit the notification bell so that you'll be notified when a new video comes out. And thanks for listening.